Come to work with a cardiac sonographer, 8-hour shift edition. If you work in a hospital as a cardiac sonographer, you never know what your schedule is going to look like till you get in for the day. Some days it's dead, and then other days you're slammed with inpatients. Usually my first 30 minutes of work is just getting myself together, turning machines on, getting everything stocked, looking at my schedule. Gotta do a little fit check. When I logged onto my computer, I quickly saw that we had a crazy schedule, so I immediately started stocking everything, getting the IV kit set. I was going to be doing mainly outpatients this day, so I just wanted to make sure that everything's stocked and I didn't have to keep running back and forth for supplies. Most of our outpatients typically get IVs because they're oncology patients and they need Definity. We also see a lot of patients that have things like coronary artery disease, so use Definity on them. A large portion of our population are smokers. Typically their images aren't going to be the greatest quality, especially if they have COPD. But yeah, we do a lot of IVs. This particular patient I needed to do a bubble study on, so here's me just getting all my stuff ready. This patient did have a small PFO, nothing concerning, but it was still there. I swear I get all the positive bubble studies over my coworker. It seems like half the bubble studies I do end up being positive. Anyways, I went and did another inpatient, and then I had another stress echo to do before lunch. And I was so excited for lunch this day because my coworker's husband makes the most delicious, authentic Puerto Rican dish. It's literally one of my favorite things to eat. I could eat it every day. After lunch, I had a couple more patients to do, and thankfully their echoes were normal, so the reporting was pretty straightforward. And here's a little left ventricle pumping away in the short axis view. We had a pretty busy day, lots of inpatients, and a full outpatient schedule, but we survived. I still had a good day, and I got out of work on time. Some days it feels like a ton of inpatients always flood in the afternoons. If it's urgent, I'll always stay and do it, but if not, and the patient's getting admitted, it can always wait till the next morning.